So our next case is a 72-year-old female who presented with abdominal pain. EGD revealed a 1.5 centimeter submucosal mass in the proximal antrum/body. Endoscopic ultrasound with fine needle aspiration confirmed GIST, which was CD117 positive. The patient was referred here for further evaluation. This is a picture of the EUS with FNA of the GIST. So we're going to go now to Dr. Binmoeller.
Okay, so you can see there's a little protuberance here. And let's just take a quick look with our mini probe. So this is apparently a small gist. Now it's pretty broad. Half of it is outside the muscularis propria and half of it's on the inside. So you see nicely the muscularis propria here. And here's our gist lesion. And you can see how it communicates with the muscularis propria. And the size, I'm not sure exactly where that would be, but somewhere there, 15 millimeters. This certainly could be removed, obviously laparoscopically with wedge resection. I think what I'd like to do is just sort of see if it's possible to retract this far enough to loop it. If yes, we'll go forward and do it. If not, then we'll just release it. And then we'll need to send her on to the surgeon. All right, so open the loop, please. Okay, so we're just going to place this over the gist itself. You can see out there's the indurated part. So I'm just going to move up to a part that's hard. Out. Okay, so now it's out. We've got the gist, and the question is, can we get the whole thing? So I'm retracting now, pulling, and we'll try to close the loop. False way, please. False way. Good. Now real way, please. Real way. Real way. Real way. So you can see the cable advancing. I'm pulling pretty vigorously because I have to really pull the gist into the lumen here. Okay, is it tight? Okay, release, please. Tell me when it's released, and then I'll release this. Okay, go ahead and release this now, please. Julie, thank you. Release the anchor. Okay, this is the vesico tri-pronged anchor, and go ahead and release the loop completely, please. There we go. There we go. All right, now just jiggle. All right, done. All right, give me the needle knife. So the next step is the incision. Unroofing. So the unroofing has gone through several evolutionary steps, and I used to just make one, little tiny incision large enough to get my biopsies. Well, now I have found that the unroofing is very important to help the gist to enucleate. So we really want to unroof this as much as possible. So we're actually doing now a cruciate configuration. So here's the needle knife, and let's go ahead and out. And so we're just going to start up here somewhere and just kind of go down. Yeah, that blood is from the congestion. All right, and then we're going to go this way. Get across going. And it's always better to start from the outside and go inside, like that, rather than go from inside outside, because you never know where you might land with that needle knife. Now when you start to look, you're going to see the gist right underneath here. All right, so that's enough for this. Now let's get the second loop on. So the second loop reinforces the enucleation effect and the ligation of the tumor. In other words, the ischemia. So we're putting a grasping forceps through the left channel. So the idea is that we want to make sure that our second loop is below our first loop. All right, so let's go ahead and open the loop. And let's advance this through. And now Julie's going to open the forceps. This is a rat tooth forceps. So we pull back until it straightens out. All right, there it is, straightened out. We can push this loop up, over. We can continue, unfortunately, all this deformity. But now what I need to do is I need to get this second loop underneath the first loop. Okay, and then what I'm using this to pull, see, to make sure that I'm getting this. Now I'm putting this loop down. Try to pull the false way. This is the tricky part. Okay, that's good. All right, now I'm pulling it up. Now tighten. And tighten it the real way now. It's good. So now I'm going to tighten, and she's going to do the same thing. Really tighten it forcefully for me. So I'm using this one here on the left to pull, retract. And the right is the loop that's ligating below the first loop. And she's doing it really tight, and now you can release. All right, so now we've got our second. Now the bleeding already is less, isn't it? So we've got a better ligation effect. So we're using, once we have the first loop on, it's fairly easy getting that second loop to engage below the first one. There it is. All right, let's get our biopsies now. So we bring her back then in about 6 weeks. And what happens is sometimes the loops loosen a little bit, close. It's okay, close. Now that's a nice chunk. There, see? There we got it. That's going to be diagnostic.